Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today's Monday, February 1st, 2021, and it's time for our COVID-19 afternoon update. And yes, it's February. So January is gone, and we're now into the second month of 2021. And I want to thank you for joining us, and we'll get right to the numbers. And the weekends, the numbers continue to do what they've done over the last few weeks, which is very encouraging for not only the health system, but our community and to our families and friends as well. So we're continuing to see the numbers down. From a hospital's perspective this morning, we have 15 in the hospital with COVID, which is consistently down. In ICU and the floor are both down. So we're seeing those numbers continue to decrease. So those are good things. They're about 10 to 12 patients less than we had last week. When you look at our hospitalizations as a percentage for our region, which is F, you can see that we're down all 3 days, the 29th, 30th, and 31st as of yesterday. We were down below the 15% threshold. And that means our COVID patients were less than 15% of the total staff beds in our region, which is Region F. We actually yesterday were at 13.94, and the day before that 14.89. So it was good to see that decrease, and it's good to see us below that line for the last 4 days. And as we continue to stay below that line, the state will take us off some of the requirements, and we'll have the ability to do some things differently. But it's not going to change what we're doing from a fighting standpoint. We're going to continue to do the things necessary to mitigate the spread and continue to go down. This is Region G, which is below us. This is the Tyler area. And you can see that they hit 14.11 today, 14.65 the day before. So you can see they're continuing to go down as well. This is January 30th. They were 14.11 was that one on the 30th. And then yesterday, the 31st, because this one didn't get updated, I saw just a few minutes ago, it's at 14.11, which is down from the previous one at 14.65. So that was a good sign. 3 days in a row we've gone down on that one. And the same thing with Dallas. It wasn't updated yet. Ours was, but those weren't. And over the last couple of days, this is January 30th, and they were at 18.82, and then yesterday they were at 18.38. So now for the last 3 days, they've been below that 20% mark for the first time, which is a good 1 out of 5 beds were COVID. And that's just a staggering number when you think about it that way. But as you look, as it continues goes down, it's a good sign. And we look at the total beds, you can see over the last 2 weeks, you can see where our numbers have gone. 152 versus 177 at our peak for COVID beds. Went up on Saturday, then back down on Sunday as they were reported. And then ICU beds continually drift down up into the 48. So we are consistently seeing in our area those beds go down. It's not dramatic. It's not happening overnight. You know, we've had the discussion time and time again. We're not flipping a switch and COVID's going away. We're going to continue to monitor this and continue to watch it and do the things. This is the Tyler area, and you can see that their beds have taken a significant drop over the last 2 weeks, almost 75 beds down over the last few weeks. And the ICU beds have come down, not as steep as ours, but their ICU beds are coming down. So Dallas, I didn't have their numbers updated yet, so I didn't include them. And but you can see that, but the Dallas numbers, when I look at them through Saturday, they continue to go down, and actually significantly down over the last 10 days, probably 1,000 beds when you look at it across the region. In the Dallas Metroplex area. So we're seeing that things continue that we saw last week. So from that, we have to be excited. We have to look at that and just look towards the future of things we can continue to do. And hopefully we're in a sweet spot right now. We met with our physician, our medical staff a few minutes ago, that our COVID task force team, and just walked through a couple scenarios and what's going on to get their update from their offices and then around the community what's going on. We're continuing to work on our vaccines. We met with the state on Friday, and we're working closely with Senator Hughes' office, the state infection control office, and other partners in the Northeast Texas region to bring more vaccines to this area. We did not receive any last week and are not scheduled to get any on the shipment that's today. We're pushing hard to get more vaccines next week. We have distributed, as of a few minutes ago, all the vaccines we have, first dose and second dose that we've received. So we're doing exactly what the state wants us to do to get them out as quick as possible. We're meeting the requirements. We had a good meeting with them. And hopefully the state, we got an update from the federal government as well, that the state hopes on Wednesday of this week to go from getting weekly allocations from the federal government to getting 3 weeks of allocations, knowing what their allocation will be not only this week, but next week and the following week, and start getting on that 3-week lag period. That'll help the state, because then they can tell us, and then we'll be able to communicate it and get prepared. Right now we're prepared, and we're hoping, we're building it for it'll come. And I know that's a cliche and that's a movie that you may or may not like, but the reality is that's what we can do right now. We have put everything in place. Judge Lee has helped us and pushed at the state level, and Fire Chief McCrae has helped us as well. And between all the three organizations, we're doing what we need to possibly be able to have a hub in this area. So we're looking forward to that as a possibility. We won't know for a few days, but as soon as we know, we are preparing. And hopefully we'll get it. And if not, we'll keep moving in another direction. But I just want to keep everybody updated. We encourage you to go and use our wait list. If you have internet access or you have somebody who doesn't have internet access, this is the best way to do it. This is the easiest way to get on, ask a few questions, our way to communicate with you. And that's what we're looking for right now is what is our way to communicate with you. And if we continue doing this and keep doing those things, Jack Ainsworth just put a comment at the bottom about people that – to achieving lower numbers in the work, and he's right. And he is on the front line, him and his team and his family, his wife and his son on the front line helping all this healthcare community fight this disease and do the things in place. So we appreciate his support and his team's support over the last few weeks, since the beginning in March. We've worked closely with Jack and his team to make sure they've had what they need, but they've done the same to us, and we appreciate that as well. But go to our website, TitusRegional.com, input your information. We talked Friday, and since it's here, I have to do it, and I have to have a heart, do my little heart symbol. And, yeah, that's cheesy, I know, but it's fun. We have to find rays of light and just enjoy and have fun in life. But it is Heart Month, so we are going to spend a couple minutes of each one of our broadcasts each week. We'll do and talk a little bit on things for Heart Month and cardiology, and I truly appreciate our cardiology team at Titus, Dr. Sekulich, Dr. Abbas, and Dr. Siegel, and what they do for this community, not only for this city, county, and hospital, but for Northeast Texas. All three of them are phenomenal physicians that are doing some great things for Northeast Texas. And cardiology or heart disease is the number one cause of death in Northeast Texas, so it's something we have to take serious and something we have to work hard. So truly appreciate that group's support and the work that they're doing to combat cardiology disease and heart disease in this area. So, again, good news this week so far. It was a great weekend. We have hopefully Wednesday when we get in here and Friday, we'll lower the numbers each day and continue to see this decrease over the next few weeks. And hopefully from the vaccines, maybe we'll see an increase on how many vaccines. So maybe we'll see a contradiction in each other over the next few days. Thank you again for your support of our health system and our community. God bless.